Okay. So they were dragging Wumi. Someone else should talk. But did they reconfirm the actual date of Pi?
Yes, from the beginning.
From the beginning, it was reconfirmed. So,
what dates and what time?
Okay, so what are these idiots talking about?
Those ones can say anything they like.
Those are just conspiracy theories. So.
Another line to validate what social media. She also confirmed that it was alive while they were rushing.
And they asked her if
while they were going to the hospital, it was in a sitting position, not lying down. The funny thing, let me say something here. That clarifies that he was quite conscious when because if he was asking questions, what injection are you about to give me? What is this one for? So his mental state capacity was 100% as at that time she was there.
And they asked her if she was aware of when Mohbad was transferred from the car to the bike. Did she confirm yes or no?
Yes, she was aware, yeah.
She was aware. So, okay.
Can I just speak briefly regarding the medications and she not knowing the side effects of any medication? Number one of the side effects of any medication at all, even if it's medication to help you not to vomit, one of the side effects is nausea and vomiting. Mm-hmm. Any medication can make you nauseated and cause vomiting. That is one of the signs and symptoms or side effects of any medications at all. The rashes and then the extreme end is allergy. She not knowing that even giving any injection will cause pain, thinking because I'm giving you paracetamol injection, you're giving something through an injection, through a needle, it will cause pain. There can be reaction at the site, there can be anything. So she too not knowing all these side effects shows that she is extremely unaware of what she was doing. And we've talked about this, like, but I remember that she's seen this being done. She does not know the reason why it's being done. And this is why I get upset when Nigerian comes and say, oh, the auxiliaries, they know more than some of the trainers. I said, no, because you cannot tell me because you've seen a surgeon doing surgery, because you've seen him doing it, you've been watching him doing it, does not mean you know how to do it. Because anyone can give medication, like we've seen this has happened, but anyone cannot prevent or help when it goes haywire. And that is why education is important. This is why people go to school to have this knowledge.
Let me help you out there. It's just like learning, you should learn practical, but not learn theory.
Even the practical she does not know the pharmacokinetic the pharmacomechanism of any of these medications. She does not know how these medications work. She's saying she's mixed ketrazone in a 10 ml. She's diluted it in a 10 ml, but she does not understand that you further dilute it in 100 ml of solution go slowly for at least 30 minutes. And even ketrazone is an extreme, use of
Can you please talk about what she has said she has gone to look for?
The hydrocortisone. Hydrocortisone is not the first line of. It could be it is an antidote. Yes, it can help to reduce swelling. It's a steroid anyway. It can help it, but
does it come in cream aspect as well?
Yes, some comes in cream as well.
In white and purple.
I cannot specifically say because of different pharmaceutical companies making different colors. So we don't go by colors anymore. So we go by the trade name or there's trade name and there is the other one I can't remember now. Or America will say paracetamol. We will say paracetamol. America will say acetaminophen. So there is a make name and there is a trade name. So in this situation, if she has gone to the pharmacy and tell them, I've given an injection, this person is reacting, the pharmacy could have had an EpiPen. But unfortunately, from what she has said, the generic name, thank you. From what she has said to us now, a pharmacy does not even have hydrocortisone. How sad it is. The WHO standard of medications that should be stocked, EpiPen, paracetamol, and hydrocortisone are part of it, even more than antibiotics, because So this is the situation.
Can it be bought anywhere, anyhow?
It shouldn't.
It shouldn't, because I'll tell you something.
That's why the first pharmacy did not sell for her.
No. The thing is, if she told them, if she has it. They didn't have it.
He said the second one had, and they bought it at the second pharmacy.
Yes, but what I'm saying is,
the thing is, I'm surprised that you're saying, okay.
Yeah, the major, what I'm talking about is because what has happened is time critical. Something needs to be done, and it needs to be done now. So everything that has happened is time critical. If she has gotten to the first pharmacy and there is a trained pharmacist on ground and she has told the person, I gave medication, this person is having a reaction, a trained pharmacist will know what to do. You understand what I mean? So everything is time critical. Pharmacists know what to do immediately. Even if she's gone in there and asked them for hydrocortisone, they don't know why she needs an hydrocortisone. So they might tell her, we don't have it. But if she has said, something has happened, this person is having a reaction, I need help, the pharmacy will probably leave whatever they are doing, get the antidote, and follow her down there.
In Nigeria?
Yes, it's. It would.
My doctor friend that I told about this, she was like, there's no way she would have even made it back before he probably cried or something. That with that type of reaction, like it needs immediate, what's it called? EpiPen or something to counter that reaction.
EpiPen in Nigeria.
No, but it's not about Nigeria. At least the second pharmacy had it.
Had an EpiPen.
They bought it now. Did you listen to what I read?
No, Elizabeth, she didn't buy an EpiPen. She bought hydrocortisone. Yes, hydrocortisone is different from EpiPen. EpiPen has a form of epinephrine. Epinephrine or adrenaline has this. It's got the injection called adrenaline. Adrenaline helps in an allergic reaction, or even when a patient is going into cardiac arrest, you're giving them an adrenaline. It's a form of cardiac medication, and it helps to is a vasoconstrictor, because when you vasoconstrictor means it helps to constrict the vessels in your heart, and it helps your heart to start pumping. Because when a reaction like this occurs, there is a vasodilator. It means every of your vessels are open. It's like you open a tap. That is what vasodilator means. It opens a tap. So instead of your heart constricting and helping us to have that pumping that you feel in your heart, is not happening. Everything, that's why the blood pressure drops, the heart rate drops. There is no proper blood supply around the body. There is no proper blood supply to the brain. There is all the rush of all these fluids going to the neck, or the throat, or the larynx, and the pharynx everywhere around. So everything is swollen.
There's something happening with you. Are you using earpiece or something?
Is it me?
No, it's Kudus. It's me.
Me, my son, Kokon.
Yeah, you're not speaking, but as she's speaking, there's a sound coming from your end.
Oh, I'm sorry. Let me mute.
So all this reaction, yes, you're right, Lilibet. 5 minutes. 5 minutes is top when situation like this has happened. If they if any of them have an idea, she's noticed goosebump is happening. She's noticed something is not right. She could have told them there are boys in the house, 3 men or 3 boys at that moment. Start pumping the heart while I quickly go to the pharmacy. Somebody is saying, not in Nigeria, look, we keep thinking things doesn't happen. You've not had the experience doesn't mean it doesn't happen. Like I said, a trained pharmacy will know what to do, and they would have got up to help. That is the fact. So we should stop saying, not in Nigeria, not in Nigeria. If we all have that attitude, nobody will get help. They are trained. Trained medical personnel are trained to give help in an emergency. It is by law and it is ethical. You must give help.
But the
That
question
is a fact.
Mayor, the question is, what type of pharmacy have they gone to? She pharmacy Omoibo Loloni. I bet the main one. Because I'll say something to you. I went to this pharmacy, Nino ShopRite. It's called Health Plus. Right beside ShopRite. If you know ShopRite, so and I asked them, do you have so medication? A whole pharmacy, a whole registered pharmacy in Nigeria said to me, no, I was so disappointed. What?
Well, it's not they ran out. Can they run out? Yeah, they can.
Yes, they can. But for them to say to me, we don't have it in stock for so days. Come on. What are we talking about?
Well, I think
If I run out of medication, they will tell you we don't have it, but you will get it tomorrow. Or they will call you to come and get it that same day.
Are you talking about MedPlus?
Pardon?
Are you talking about MedPlus pharmacy?
MedPlus is fine. I'm talking about Health Plus. It's right beside ShopRite. No, Keja.
Maybe the personnel did.
Pardon?
They should have directed it to the nearest store.
They did, because I was actually looking for MedPlus. But I think there was a
What they usually do is to call the closest branch and then direct to them to look at if they have run out.
Well, I'm not speaking in their favor. I believe that
MedPlus is around. You understand, Lagbaja? But this Health Plus, I think their color is blue. And MedPlus is green and white.
Green and white.
Yeah, I know what I'm talking about.
I believe it's not. I think it's normal if a pharmacy is out of a particular medicine. Like, it's different if they say they don't even know what to do.
Next round of it. Just halfway through.
Okay.
Yeah, that is
Say we should round up the discussion, or you want to, Lagbaja?
Yeah, I think that's what he said.
Yeah, just 2 minutes, then we'll go back.
Oh, okay. Another thing I noticed is that lady, she doesn't really understand English or something. Or is it me?
It's not about not understanding English. She's not qualified to do that job. I'll say something to you. They were asking her, are you an auxiliary nurse? And she said yes. Get the qualification, and she said GCE. Sorry.
Yeah, she's just an illiterate.
You see, where I'm going to hold the hospital that trained her responsible is Kilo Telephone Certificate.
I don't think they gave her.
Okay.
That's what I'm saying. I don't think they trained her.
They didn't train her. Okay, I rest my case.
Because even the police preliminary reports, when they talked about where she's supposedly trained, they said that she didn't even have any certificate or anything. That equals to her being a quack. So she actually doesn't have any qualification.
Wow.
Yes, because our conversation with me, whenever I think I know but the thing is, like everything they ask this lady, no. To buy for your interveners, to buy for your lily, do you know the reaction? No. To buy she let me to everything they ask. Am I right or wrong?
Sure.
I didn't start with you, but
that's what I'm saying. That's what I'm trying to say now, that most of you now, you didn't even start with us. At the beginning, everything, those questions was the first thing they asked her. In fact, it was out of that pain that Sanshitu shouted, "You killed him!
You buy him!"
Because you see, the flag, like, but Sanshitu was so upset, asking her all those questions with anger. So she was like, "You're going to turn pillows. Damn it! Yeah, you can't waste your boy, darling." Everything they asked her, about okay, Toba Fian injection by Toba Sugar. What's the reaction? Only spending only tetanus one. That was from the beginning. Said Sandy just called and said bring tetanus injection, blah 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 blah. So she was like, she didn't even have any idea of anything. So it's because he didn't hear all this. That's why we are still having this. She didn't know. She didn't even know anything. Anything. Jesus. God waste the boy down. And that was how I just imagine my for him. But I told you, Kudus, I will speak on Jimmy. Yeah. I'm only saying.
So what I was saying before you, yeah, you know, when I started my submission before we got into it, I was like, even though I didn't start with everybody, I realized that she was very nonchalant. She didn't know anything. She was just saying no. And I could see that she's also an illiterate. She's just like all these newsers that say they are training to be a nurse or whatever. And she's actually a quack. So, okay, let's... who else? That British, you haven't said anything.
Yeah, good evening, everybody. I was quiet because I was just coming in I just walked right into it. So I don't know what has gone on. But you know, when Timmy just spoke now, like I had the chills, and I'm not even exaggerating. Like I felt some chill over me. Like, how could you have even gone on such assignment and you have zero knowledge of what you've gone to do? But like what I was writing earlier today, it's all about systemic failure and all of that. It wouldn't have happened anywhere in the developed world. It would not have happened. So yeah, it's unfortunate we lost Mohbad in that process. And again, another thing, sorry, because what went through my mind again, even though I don't know what you guys have said so far, but again, based on what Tammy just said and the reaction of Sanchitu, so was Baba Mohbad in that court listening through all of this, and he's still saying that as in how? But I would mute so that the emotions doesn't get the better part of me. This really riled me up. How a father can sit through this, even if he didn't sit, even if he wasn't there, he would have heard. And he's still saying, so I would mute.
Please, check your words are very important. I was
another thing before we
recorded everything. So after it, we can play the beginning for everyone, so we can listen again. Even wait for this nonsense that she's saying now before we know that this lady is. Look at that. Just say that. Go and do this thing and leave there, because they already had the intention of after it or bury. That is just what I conclude with and made me to just like let me go and you know what? I now got me.
It's something that someone would want to explore now.
Because it was just like, go and inject this guy, leave there, don't worry, no question. And that's one thing where I picked all stations settled from. If you start, you just conclude with the other things you've listened to on this case. This lady has nothing to do with nothing at all. So it's just like, love, child, kick, tekinis, Lara, she lazy, what's the law?
But your chemist or relationship.
Any long time now, she found to Dido ni. Dido ni.
Oh, Mandela.
Dido lunta.
That's why, Fatemi, I don't really know how Spendy is going to escape it. Because he knew that she was a quack. He knew and he still recommended her. So I don't know how he's going to escape it too. So I don't know. It's just like...
But from that beginning, I saw somebody's comment. The person said something like, standing. Because and reason why the Malians are rooting for you when you were in prison. In fact, I saw that comment and I was like, yeah, I think my people are really moving together with this lady's answer now that they only ask this lady to go and do something. Do it, leave there. And now you now see it from the angle of nobody's mentioning this lady's name because they've give her that assurance that you just do what you need to do. Leave every other thing to us. Awala mama shishe. Because this lady is so relaxed, like nonsense and you are just there. Group lunch or shaye lunch here. It will be like toba loss up my fashion go for me there by shisha my casting. That's what I'm seeing here.
Even the father now, as the father mentioned her name in the past 18 months or 19 months.
Parents that don't worry.
5 minutes straight.
I will go back to it and we'll talk more about this, please. Miss Oche, we're very annoyed. More enjoy more enjoy it.
Okay, guys, let's continue. Thank you. I love what we just did. You made me know that I wasn't just reading in vain. Okay, my attentive panelists and commenters. Oh yeah, let's keep on tapping now. Okay. Cross-examination by Kabir Akingulu. Question. Witness, can you tell the court how many injections you administered on Mohbad? Answer. It was 3 injections. Question. You have stated before the court that you thought you were an auxiliary nurse. But as at today, when you are answering questions from him, that the Institute of Midwives has said that you are not an auxiliary nurse. You didn't know before you treated him? Answer, sir, I am not a qualified nurse, but I am an auxiliary nurse. Question. As an healthcare provider, do you rely on what somebody tells you as a patient or on your diagnosis? Answer, I rely on my diagnosis and what I have been told. Question. In this particular situation, there was no diagnosis. Answer, just physical diagnosis. That is all. Question. Are you a herbalist or health provider? Answer. I'll go back. This is funny.
I can't hold that, please. I finally praise the Lord.
Oh, yeah.
Is that not our lawyer?
That lawyer.
Is that not our lawyer?
Yes, he won.
Let's go back. Question. As an healthcare provider, do you rely on what somebody tells you as a patient or your diagnosis? Answer. I rely on my diagnosis and what I have been told. Question. In this particular situation, there was no diagnosis. Answer. Just physical diagnosis. That is all. Question. Are you a herbalist or a health provider? Answer. Health provider. Question. You couldn't have known by merely watching somebody that this is what is wrong with this person. Answer. Yes. Question. You said you did physical examination. Are you very sure? Answer. Yes. Question. You said you looked at him from head to toe. Is that correct? Answer. Yes. Question. Did you see any wound apart from the laceration on his arm? Did you see any other wound on any part of his body? Answer. No. Question. So if anybody said that his head was broken, would you have been surprised? If anybody said you treated him for broken head or neck, you will be surprised. Answer. Yes. Let me read this place again. Question. So if anybody said that his head was broken, you would have been surprised. If anybody said you treated him for broken neck or head, you will be surprised. Answer. Yes. Question. It is not unusual when somebody convulses when he is poured water on. It is common when somebody faints, they pour water on him. When somebody faints or is having seizures, in Yoruba land, they pour water. Answer. I don't know. Question. Now you have said if they pour water on someone, it can cause negative things. Is that correct? Answer. I was not the one that poured water on him. Kabir Akingolu, I'm just asking you, in case you know or you don't know. Answer. I don't know. Question. If you see someone doing something that could harm your patient, are and you know that that thing can buy, will you allow that person to do? Answer, my lord, Kabira, yes or no? What was the question? The question was that she gave evidence earlier that they poured water on the late Mohbad. That if they poured water on somebody, that the water can have negative effects. I'm asking that as a healthcare provider, will she be watching if truly she knows that that thing has negative effects? Will she still allow somebody to do that which she knows was wrong? Answer, the person doing it is the wife. How am I supposed to stop her? Question, now, if you have gone to treat the patient and you're supposed to be in charge of that patient are you supposed to be in charge of that patient or the relation? Answer, we have to be there together. I have to be in charge of the patient. Question. Now, when you were going to the hospital, I put it to you, if you are a nurse, the appropriate thing to do was to sit down beside the sick person, the person who was not feeling fine. That is the standard practice. Witness, while he was reacting to the injection, question, yes or no? Answer, no. Question. So if somebody is to be treated and is reacting to injection or the condition is being worse, the nurse will abandon him? Answer, I did not abandon him. Question, but you were not with him? Answer, I left him to get an antidote for the reaction of the injection. Question, if you had gotten that antidote, hydropod, if you were able to get it on time that day, it would have suppressed that negative reaction? Answer, yes. Question, you also said when you left your house, they did not tell you the nature of the wound? Answer, yes. Question, that if they had told you, you would have just said, go to a pharmacy? Answer, yes. Question, that is to show that what was wrong with him was a small thing? Answer, it was a cut. Question, a small cut that is not substantial? Answer, yes. Question, now, if they have told you the nature of the wound, how would you have come with hydropod and other things that you were supposed to use? Answer, if they have told me it reacts to injections, I would have come with the hydropod. Question, it is not unusual that when you treat someone, he may have some reaction. Is it possible most of the time? Answer, yes. Question, so the standard practice, I put it to you, is that when you are going to inject someone or when you are at the hospital, the antidote is always close by? Answer, yes. Question, now, by not asking for the medical history of the disease, it was a mistake which anybody can do? Answer, yes. Question, now, Cornerstone Hospital is not a nursing school? Answer, yes. Let me read that place again. Now, Cornerstone Hospital is not a nursing school? Answer, yes. Question, now, you said you sometimes treat with doctor's prescription? Answer, when I was at the hospital, yes. Question, so in this circumstance, was there any doctor's prescription before you commenced treatment? Answer, there was no doctor's prescription. I was given first aid. Question, was there a medical prescription before you treated Mohbad? Answer, there was no medical prescription for a cut. Question, so you just got there and said this is what you should do? Answer, because in what I learned from the Cornerstone Hospital, that is what should be administered to people with a cut. Question, now on that day, you gave him tetanus injection, right? Answer, yes. Question, is it in all cases? Answer, in my knowledge, if me myself should have cut, I would take tetanus injection. Question, these 3 injections that administered on him, what were the intervals? Answer, the tetanus injection, I gave it to him at the left-hand side intramuscular. Like how many minutes to one another? Answer, the interval of the tetanus injection to the paracetamol injection is 9 minutes. Because after I gave him the tetanus injection, that was when we were now talking about the ulcer stuff and all. Question, now, was it the wife that asked you to inject him with 3 injections? Answer, it was not the wife. Question, you used your discretion? Answer, yes.
Let me read this place again. Question. Now, was it the wife that asked you to inject him with 3 injections? Answer. It was not the wife. Question. You used your discretion? Answer. Yes. Question. You said you were looking for the hydropod. Somebody called and said that he was convulsing. Answer. Yes. Question. So he was already convulsing before you got back home? Answer. Yes. Question. Now, if there's anything shown to you to the contrary, will you be surprised? Witness, I don't understand your question. Question. You said you went to look for hydropod. Answer. Yes. Question. And while you are there, somebody called and said he was convulsing. Answer. Yes. Question. Which means he was convulsing before you got back home? Answer. Yes. Question. If anybody tells you that he was not convulsing before you go back home, will you believe the person? Answer. No. Question. At paragraph 38, you said that at this point, I don't have access to go back into Mohbad's house, as everybody in the house was already outside, and the plan was to get Mohbad to the hospital as quickly as possible. Answer. I told Ayobami when we were coming that they should take him to the hospital. I don't know if they called him, or he was the one that called, but that was when they told him he was convulsing. Now, at paragraph 39, you said he was not convulsing in your presence, and he was not convulsing when you go back to the house. Answer. Yes. Question. So which one are you picking? Answer. He did not convulse in my presence. It was Ayobami that they told that he was convulsing. Question. So you did not believe he was convulsing? Answer. They told Ayobami that he was convulsing. If he was not convulsing, they won't tell him that he was convulsing. Question. In this circumstance, failure to ask for a patient's medical history is a negligence and mistake? Answer. Yes. Question. And you made a mistake in this circumstance? Witness shakes head. Question. You said you did not ask for medical history. Is that correct? Answer. Yes. Question. And you said not asking for medical history is a mistake and negligence. Answer. I did not say negligence. Question. So it was deliberate that you did not ask for medical history? Answer. It was not deliberate. At least the people did. They told me he was an ulcer patient. So why did they not also inform me that he reacts to injection? Question. But you did not ask? Answer. When I asked if he was an ulcer patient, I was told. Then why wasn't I informed that he also reacts to injection? You have told the court that you will have to ask for the medical history of the patient. And you have also told the court that you did not ask for the medical history. Question. Now I say, not asking for the medical history is a mistake or negligence anybody can make. What is your answer? Answer. Yes. Question. So in this circumstance, it was a mistake? Answer. It was a mistake on both ends. Question. Can you please confirm to the court that it was when you gave him the injection that the goose pimples showed? Answer. When he went to vomit. Question. After the injection? Answer. Yes. Question. So this is one of the normal effects of anybody who reacts to injections. Is it correct? Answer. Yes. Question. Now at the police station, can you please tell us how many of you were there? Answer. Me, Spending, Fine Boy, Naramali, and Samilari. Question. About 5 of you? Answer. Yes. Question. At the time they were carrying him out, you could examine somebody just by sighting. Now, if you could look at somebody and know what is wrong with the person, now when they are bringing him out to take him to the hospital, what will you say? Was he dead or half dead? Answer. He was not dead. And I don't know what you mean by half dead. I'll read this piece again. At the time they were carrying him out, you said you could examine somebody by just sighting. Now, if you could look at somebody and know what is look at somebody and know what is wrong with the person. Now, when they were bringing him out to take him to the hospital, What will you say? Was he dead or half dead? Answer, he was not dead. And I don't know what you mean by half dead. Kabir Akindolu, you have said that when you did physical examination, you looked at him or you look at the patient, you can know what to do and what was. And that was what you did here. You treated him without any diagnosis. Now I'm putting it to you. When they were bringing him out of the house, you saw him. What was the distance between you and him? Answer, the distance wasn't much, but I can't specifically say. Question, but you saw him. Answer, yes, I saw him. Question, now as an experienced person, what will you describe his state? Half dead or dead? Because the doctor said brought in 5. Sorry. Answer, I sincerely don't know because in my first time, I will see a situation of such, so I was in shock. Question, so throughout your stay at Cornerstone Hospital, there was no incidence of death? Answer, there was, but since I have been treating people, this is my first time I will encounter such things happen. Question, so before now, you've not been treating people? Answer, I've been treating people, but I've never seen a situation like this. Question, now, it is also customary that anybody you are treating, they just tell you what to administer on the person, and you just go there without any examination? Answer, no. This is a court, and what I gave to him is also what they will give him also at the hospital. Question, you just guess this is the proper treatment. Is that correct? Answer, what I gave him was the right thing I was meant to give him. Question, because of what they told you? Answer, what I gave him is the normal thing they will give to people. This is just antibiotics and analgesic. Question, you have told the court that anything could cause by. You will agree with me that negligence can also lead to by. Answer, yes. Kabir Akindolu, my lord, at this point, I think it is better to leave him. We thank my lord for the indulgence. Dr. Wahab Chitusan, my lord, may I seek to ask 3 questions?
Lagbaja, sorry to interrupt. Before you go further, if you are using earbuds or something, could you please look into it and adjust? You are very low, even though my phone is on the highest, and there seems to be some sort of interference, and it would eventually also have effect on the recording.
What about now?
What were you doing before you took a break? Because you were louder then.
Okay, so what about now? Can you hear me now?
Yeah, better.
Okay, sorry. Cross-examination by Dr. Wahab Shitu. By Dr. Wahab Shitu-san. Question. Now you were first contacted on the 11th of September. Answer, yes, sir. Question. What time were you contacted? Answer, I was contacted towards the evening. Afternoon, evening, in between. Question. Between the time you were contacted and the time you arrived at the apartment the second day by 2:30, how many hours interval? Answer, maybe up to 24 hours. Question. You were contacted on the 11th September, but you couldn't come that day. And so you came the second day by 2:30. How many hours interval? Answer, it's not up to 24 hours. Question, how many hours? It is very important. Answer, between 22 hours. Question, within these 22 hours when you arrived, somebody who should have taken the deceased to the hospital. Answer, yes, sir. Question, now you arrived 2:30. If somebody was to have taken the deceased to the hospital, who would that be? Answer, I don't know. Question, who would that be since you met the deceased with the wife? Answer, the wife. Question, the wife should have taken? Answer, yes. Question, now, between 2:30 and the time he was eventually taken to the hospital, how many hours? Question, answer, it was not up to hours, maybe like 45 to 50 minutes. I'll read that again. Now, between 2:30 and the time he was eventually taken to the hospital, how many hours? Answer, It was not up to hours, maybe like 45 to 50 minutes. Question. You arrived 2:30 to the premises. Answer. Yes. And then you administered injection and all that, and he was convulsing and all that. You rushed outside. How long did it take you to rush outside and come back? Answer. I don't know. Question. Now the treatment. Between the time you arrived and the time he was eventually pronounced dead, how many hours? Answer. Maybe 2 hours. Question. Within those 2 hours, how he could have been taken to the hospital? Answer. Yes, sir. Question. The decision to take him to the hospital could have been taken based on your suggestion? Answer. Yes, sir. Question. Or the wife should have taken him to the hospital? Answer. Yes, sir. Question. But the wife didn't take him to the hospital until you came back? Answer. Yes. Doctor will have you to stand. That will be all for the witness. The court. You are a nurse, the auxiliary nurse. I've called for your services that please come and treat me. What kind of questions will you ask me? Answer. I'll ask you, how are you feeling? What are your symptoms? Have you done the test? Can I see the test results? When I see the test results, I'll be able to know what to give you. The court. Irrespective of the fact that I have a court or not. Answer, ma'am. Based on the fact that he has a court, I felt that I don't really need the court. No. If I've called for your services as an auxiliary nurse, healthcare officer treating people, these are fundamental questions that you should ask. So I'm asking you, what are the questions? Answer. How did you get the court? Did you have a fight? Have you taken anything before my arrival? That is what I will. The court. So you know that you ask some questions. Answer. Yes, ma'am. When I did, I was told. The court. Just a minute. You know you should ask some questions. Answer. Yes, ma'am. The court. These questions, did you ask them? Answer. I did, ma'am. The court. What are the questions that you asked? Answer. I asked the Ayobami guy. It was Spendy that first told me that he has the court, so he felt like there's glass inside the hand. The Ayobami guy now told me that he's bleeding. So me and the Ayobami guy spoke on the phone, and when I got there, I asked him, has he been given anything? He said no. The court. Your patient that you went to treat was in a state that you could relate with him. Answer. Yes, ma'am. The court. So why didn't direct your questions to your patient? Why hearing from others when he was in a position that he could give you direct answer? Answer. I did not. Cross-examination by Kabira Ingolo. Question. You have stated that about 4 of you were in the room. Answer. We were 4. Question. One person then followed you. Answer. Yes, remaining 2. Question. Who and who? Answer. The husband and the wife. We were 4. Me, Ayobami, the husband and the wife. Question. So you left him with his wife? Answer. Yes, sir. Kabira Kimbolu. When they were pouring him water, others have been giving evidence here. Nothing you say will change. They stated that it was Adura, the younger brother, that poured. Answer. It was not Adura. We were 4 in that room. Only if the DJ wants to lie. Question. At what point did Adura join you people? Answer. It was at the hospital. I don't know if he was the one in the car, but I saw him at the hospital. That was the first hospital. Question. Based on what you have told the court, generally speaking, you were not supposed to be called to treat somebody because you are not an auxiliary nurse. Answer. Yes. Kabira Akimbulu, that would be all, my lord. Cross-examination by Dr. Wahab Shitu. Question. You were informed there was a glass pot. Answer. Yes. And I requested to see the picture, sir. Question. Did you remove this glass? Answer. I did not. The court. Did you look at the wound? Answer. I looked at the wound. The court. How bad was the wound? Answer. Ma, it was not that bad. The court. So rating it with glass that they had told you, did you further investigate whether the glass is still inside or not? Answer. The Ayobami guy, it was a day before the next day, the Ayobami guy told me he removed it. After, at first, I saw the picture. The court. Getting to your patient with that wound, did you look at the wound, yes or no? Answer. I did. The court. looking at the wound that you have come there to treat, did you find out whether there is still a piece of glass inside as you were told? From your investigation, healthcare officer, I've looked at this wound. Okay, maybe it is free. What would be the swelling and all that? Did you further investigate? Answer, I did not. Cross-examination by OSA Aromalaran. The court, what paragraph are we looking at? OSA Aromalaran. I'm looking at paragraph 62, 63, and 64. Question. You mentioned in your paragraphs 62, 63, and 64, you highlighted in those paragraphs how you were among the crew that went to the police station to fetch for police reports and to equally obtain medical cause of death certificate. Were you able to get those two certificates? Interesting. I'm going to read this again. OSA Aromalaran. I am looking at paragraph 62, 63, and 64. You mentioned in your paragraph 62, 63, and 64, you highlighted in those paragraphs how you were among the crew that went to the police station to fetch for police report and to equally obtain medical cause of death certificate. Were you able to get those two certificates? Answer. I cannot remember if they were giving the police report or they were giving the death certificate at the hospital. Question. Were you able to cite it? Answer. Yes. Question. What was the cause of death mentioned on that document? Answer. I am sure. Question. But you cited it. Answer. It was inside an envelope. I was not given. Question. As a medical person, I haven't cited it except if she's negligent on that side too. Citing it. What was the cause of death mentioned on that document? Answer. I did not see it. Question. You only saw it in an envelope? Answer. Yes. Question. So will you agree with me that it is also a negligence on your side because you are the one who administered on him, who helped to take him to the hospital, and somebody was going to lie against you or against your patient on what caused his death? Did you take steps to exonerate yourself at that moment? Answer. I cannot exonerate myself at that moment. Question. Assuming without conceding that medical paper, if you see it today and it's written on that document that you are the one who fired Mohbad, what would have been your reaction? Witness. No response. OSA Aromalaran. So it is a negligence of yours on your side, not checking whether it was your name that was written on the cause of the fire. My lord, that would be all. Cross-examination by Dr. Wahash. Question. What is the name of the first hospital which Mohbad was taken to? Answer. I can't remember. Question. Where? Which location? Answer. The first one is at Orchard Road. Question. A doctor attended to you people there? Answer. Yes, sir. Question. A doctor called you and asked you question? Answer. Yes, sir. Now, the second hospital, what is the name? Answer. I don't know if the first one is Perez or the second one is Perez. And question. A doctor also attended to you and asked you question? Answer. Yes, sir. Cross-examination by Abiodun Kolawole. Abiodun Kolawole. I also want to direct you to paragraph 61 to 64. Question. From the two hospitals, who issued the medical reports confirmed to this court? Answer. It was the first hospital. Question. At that hospital, was there any time you were advised to take him to the morgue? Answer. No, I don't know. It was late at night. Question. Who issued the death certificate? Answer. The first hospital. Question. Given to who? Answer. DJ Ayobami. Question. Are you sure? Answer. Yes. Abiodun Kolawole, that will be all for the witnesses. Cross-examination by Kabir Akimbolu. Question. You have told the court he was conscious when you got there. If you had asked him for his medical history, he would have given you, but you did not ask him. Also, at the time he was being poured water, was he conscious or unconscious? Answer. He was conscious. He was sitting on the floor. Question. So he could have also said they shouldn't pour him water. Answer. Yes, sir. Kabir Akimbolu, my lord, that will be all. We thank my lord for the indulgence. The court. Yes, somebody in the audience. Cross-examination by members of the audience. Question. The question I want to ask her is that she said when they called her that, that they said the hand was bleeding. So my question is, when you got to the house, was the hand still bleeding? Answer, no, my lord. Question. As a nurse, you can identify a fresh and old wound. The kind of wound you saw, was it fresh or old? Answer, the wound was not fresh. Question. Me, I can identify 2 days or 3 days wounds. As you more learned than me. Can you identify this wound? Like how many days? Answer, maybe 2 days. Question. When you got there, you saw water. They were mopping. Maybe they had actually poured in water. Do you believe maybe a nurse might have come to administer something to him that? Answer, I sincerely do not know. Question. Do you know after he had left, you were running helter-skelter, but when you left him, he was still alive. There is a minute between life and death. While you were running helter-skelter, do you believe maybe something might have happened? Answer, I don't know. Question. You never thought about it? Answer, anything can happen, I don't know. Question. When you got to the house, like how many did you see? Answer. When I got to the house, I saw a guy downstairs. He was with a baby downstairs. After the DJ took me upstairs to meet the wife and the husband. Question. You saw only one guy downstairs? Answer. Yes. Question. Did you notice any action within the compound? Answer. I did not. Question. As a nurse, when you saw the wound, did you dress the wound? Answer. I did not. Question. You didn't dress the wound before giving injection? Answer. The wound is just normal. Question. You were told that there was a piece of glass? Answer. Did you remember I also said when they sent me the picture? Report. She said she did not inspect the wound. Question. One of the counsel asked you that if you had not administered the drug or injection, what would have happened? He asked if he was still going to die and you said yes. My question is, why did you administer tetanus injection? Why did you administer paracetamol when the state of Mohbad as at that time was that critical? Answer. He has a cut on his hand first of all. In my own knowledge, when you have a cut, you have a tetanus injection. The hand was also swollen, and the whole idea of the paracetamol injection was to relieve the pain. He was feeling pain in the hand. Question. If you had not administered that pain relief injection, would he have died? Answer. I don't know. Question. In your testimony, you said Mohbad was still alive when rushing to the hospital. Answer. Yes. I'll read this again. Question. In your testimony, you said Mohbad was still alive when rushing to the hospital. Answer. Yes. Question. Can you tell the court at what point did you discover that he was dead? Answer. I do not know. It was when the doctor declared him dead. Question. You said they took you upstairs. Was Wunmi upstairs or downstairs? Answer. Answer. Upstairs. Question. What was she doing? Answer. She was with her husband. Question. At what time did Darisha join you on the way? Answer. Darisha did not join us on the way. Darisha came to the first hospital to take him to the second hospital, and I did not follow them. Question. Do you know who drove the car that brought him to the hospital? Answer. It was their neighbor. The court. Do you have any re-examination or do you want to clarify anything? A.O. Billy, my lord, I just have a few questions. The court, make sure they are questions that are ambiguous. Re-examination by A.O. Billy. Question. What is the purpose of tetanus injection? Answer. It is for wound. Question. Is it a preventive measure? Answer. Yes. It is not such that it is of a previous implication. Answer. Yes. Question. When you say tetanus injection is for prevention, what are you preventing? Answer. Tetanus from entering the hand. Question. Can tetanus kill somebody? Answer. Yes. Question. In your testimony, you said the wife told you that he reacts to injection. Answer. Yes, and the DJ was there. Question. Mohbad himself, when you wanted to give him the injection, did he object to it? Answer. No. Again, let me read this place again. Question. Mohbad himself, when you wanted to give him the injection, did he object to it? Answer. No. A.O. Bello, That would be all. The court, the state, you did not ask any question. Oh, Sibajo, I'm direct not to ask any question because we do not have the process before us at the office. The court, are we done with the witness? Counsels, we are done. The court, witness, we are discharged. The court, inquest is further adjourned to the 21st of March 2025 at 10 a.m. Court.
Who just laughed?
All rise.
Who just laughed?
Na Lagbaja dey perform all that one. Lagbaja, you are into a lot. You are into a lot. Before I joined Lagbaja, is there any part that they asked her that keep quiet and sleep? Is there any part they asked her that? Yeah. Please hold on. Lagbaja Jebawaka our first first page here. Let people just get so no. Debi ti Sanchitu ti sọ̀rọ̀ yẹn, please. What was this beginning?
Let me go back.
I'm sure in your matters, and I want us to pick that. They will now talk. So let's continue while you just drink water or something. So come get to mu Shitu fún ara wọn pariwo ìwọ ló pa bọ̀bọ̀ yìí.
No doubt. And because Wumi is the easy target, so everything she just kept on saying, the wife was there. The wife should tell me. The wife should this. The wife should that. So she just thought the lawyers and the judge, the magistrates rather, would not see through her, but they saw through her that they're just trying to push the blame on someone else.
Also, that being said, I'm really highly disappointed in the conduct of Sanchitu, to be honest. He is...
You took that to me.
Sanchitu, this is not a disrespect to you. I would have never have disrespected you. I would never have looked down you as a legal luminary, an advanced man, well-learned. I'm assuming you're well-traveled, but you are part of the people that allow this conspiracy theory. You should have done a lot of research. That is part of the job of a lawyer. You are supposed to have associates and young lawyers that should do research on you. You follow the narrative of conspiracy theorists on social media. And one of the things you were trying to do, you're not even trying to indict this unqualified person that has done this great evil. You were still directing it over pouring water on the head of someone. When we know, obviously, as Nigerians, the first thing anybody faints, you pour water. Somebody's convulsing, you pour water. Did they drown him in Red Sea? They think so. Did they pour water? Did you mix water? Can you come water? All you were interested in is the water. You were paid a lot of money to have done a lot of research. You could have gotten medical personnel to speak to you about this issue. The same you that was saying because they gave medication through parental rules automatically means the wife did not do her parental duty. How did this? It's just disgusting and despicable.
Honestly. Mayor, I'm surprised that you are actually what's the word, like you are disappointed at Sanchitu. No, it seems you've forgotten the plot. His plot is to make Wumi the suspect or the perpetrator of this thing. And I think that's what he was trying to do. You are looking at him as a son, professional with pedigree and all that. No, he doesn't care about that. He wanted to satisfy Josie, and that's why he was pushing it towards the wife.
He was paid for that. No?
Exactly. So I'm surprised that Mayor is saying she's disappointed.
No. You see, wait, darling. It's still okay to call him out on the bullshit. We know he's doing his job, but it doesn't mean we can't call out his job or the execution of his job or whatever. So that's what Mayor is calling out. Yes, that's his job as a defense attorney or whatever, or son or whatever. But yeah,